Yeah, you can start the recording. Is Hello, everyone. Good evening. Thank you so much for joining. We're going to give a couple more minutes for everyone to be able to join in, and we will be right back with you. Hello, everyone. Again, welcome to Hebe's Regenerative Aesthetics webinar. My name is Irina. I'm the CEO and the co-owner of Hebe Medical Spa. For those of you that are our existing clients, thank you so much for joining. And for all of the new clients or people that maybe haven't visited Hebe yet, thank you. And it will be our pleasure to be part of your aesthetics journey. What is really regenerative medicine? This term has become so popular the last few years, and really what it means is that how are we helping your body to naturally help you regenerate and keep you the way you are, just give the body the tools that it needs to keep you looking young and kind of reverse the aging process. And a lot of it has become because the look nowadays is we want to see people looking more natural and really preserve that beauty. We have some great information prepared for you today. I'm really excited to introduce to you our speakers for the evening. But before we get to that, couple of housekeeping items. If you have any questions throughout the call and the information you're going to see, please feel free to drop that into the questions box. And also, really important, make sure you stay until the end of the day because we have some really great surprises. For those of you that are new and you don't know Hebe Medical Spa, we started the business back in 2018, and we now have 3 locations. We have Fishkill, Latham, and Saratoga Springs. These are all the phone numbers for our locations, and please stay until the very end of the call because, as I said, we have some exciting surprises for you. Next, I want to introduce Dr. Zainab Mogul-Ashraf, or as we call her very fondly, Dr. Z. She's our medical director, and she's also co-owner of Hebe Medical Spa. We also have Leanna. Leanna has been with us for about 5 years, and we are so proud to be part of her aesthetic journey. She started with us as Dr. Z's medical assistant, and we have seen her grow and blossom into this amazing provider. For those of you that know Leanna and have sat in her chair, you would know that she is a perfectionist. She does beautiful work, and she's always so focused on making sure that clients really get everything that they came for. And I don't think I need to introduce Dr. Z anymore. She's just become such a trailblazer in the aesthetics world. She is so well versed into injectables and also regenerative medicine and wellness and peptides, hormone replacement therapy. For those of you that follow her on social media, you guys know the tremendous amount of information that she puts out there. She's an internal medicine doctor. She was trained in internal medicine. This is what has made Hebe so special, is because we do focus always in beauty from the inside out, and I feel like her training and her vision has really helped us to make Hebe what it is today. So with no further ado, I'm going to let the experts tell you everything about regenerative medicine.
All right. Hi, everyone. Thank you for that introduction. We really appreciate it. So we're going to get right into it. And I have to say, I'm so happy to be sitting next to Leanna because, like I said, she used to be a medical assistant. And the fact that I'm here sitting with you, doing this webinar, and as a nurse, it makes me very proud. So, so we'll have Leanna kick this off.
All right, so I'm very excited to be talking about Sculptra, Radiesse, and GHK tonight, but we're going to kick it off with Sculptra. So before we can dive into what Sculptra is, it's really important to understand why the skin ages. So there's 3 main foundational shifts that happen as we age. One of those being bone loss. So over time, gradually we start to reabsorb bone, and with that bone reabsorption, fat in our face, our cheeks, lower face starts to redistribute. And so we see things start to shift down with gravity as well. And so in addition to that, bone reabsorption, fat redistribution, we also have a collagen breakdown as well. So those 3 factors are really what are contributing to the aging process. And actually, as stated on the slides, we do lose about 1% of collagen per year after the age of 20. So it's up to about 20% by age 40, which is a significant amount.
And I just want to add that, if you were in my last webinar, there are actually specific points that really aging happens. And we now have a Stanford study that shows on a molecular level where it happens. Actually, it's 44 and 60. So I'm 44, and oh gosh, it's, did I feel it this year? Not really, because, well, we're talking about all the things that we did. So I don't think I felt it as bad as like a lot of my patients do, but I have noticed that a significant amount of patients at 44 specifically really feel like, oh my goodness, I look different, I feel different. And then the other really big one is age 60. So this is why we're talking about this today, because we want to make sure you guys are ready for the 44 and 60. Okay?
Absolutely. Yeah, that's an excellent point.
Yeah.
So what is Sculptra? It is not just another filler. Sculptra is something that it's called polylactic acid, and it is a biodegradable substance that we use to inject into, most specifically, the deeper layer of the skin where we synthesize collagen to have your body produce collagen from within. And actually, what's really cool about Sculptra is it first came to medicine when the HIV/AIDS pandemic actually occurred, because a lot of those patients had what's called lipoatrophy, and that's when we start to lose that fat in the face, and they were looking very gaunt. And so they said, what can we do for these patients? And they came up with Sculptra, and naturally aesthetics saw that, and we were like, who doesn't want that, right? Exactly. Who doesn't want to start stimulating from within?
Yep.
And so it was FDA approved in 2004 for that facial lipoatrophy, and then in 2009 aesthetics took it on, and it's had over a decade of clinical use with proven safety profile. And so how Sculptra works is we, as I mentioned, inject it into the appropriate plane, really to restructure that foundation where we're losing that bone, where we're losing that fat, to set that foundation just as you would for a house, right? And what the body does is it takes those little microparticles of polylactic acid and it creates a wound healing response, a controlled one. So your body's saying, okay, I need to re-synthesize collagen around these particles, and that's how you are able to re-stimulate your own natural collagen.
Yeah, and sometimes a lot of my patients are always like, okay, what exactly is Sculptra?
Right.
So I always say, hey, okay, if you guys have kids, or if you ever had like a deep cut, well, when you go to the ER or doctor and they suture you up, well, that's Sculptra.
Yes.
And what they do is they break that down and they make it into a powder, and then we mix it with water, and then we put it in your face.
Yes,
and
exactly.
then you get all this collagen. So pretty much it's very safe. It's been around actually for many years. I swear Jennifer Lopez for sure does it, because look at how natural she looks.
Yeah.
And I'm pretty sure she does Sculptra. So she's a really good example of what Sculptra looks like. It looks very natural.
Yeah, I agree to that point. I think anybody that you see in the limelight that you're like, what are they doing? It's definitely Sculptra.
Yeah, I think definitely it's a celebrity
Yeah.
aesthetic move for sure.
Absolutely. So a little bit of the clinical data on Sculptra. Typically, we inject it into the cheek region, more of this pre-auricular area. We really start to lose volume back here, and so we like to build that up to restructure as well. And so about 88% will see improved skin tightness, 89% improved skin firmness, 95% improved skin glow. Really an overall high improvement of your collagen synthesis and just that overall glow. I tell my patients all the time, wait the 3 to 6 months. It does take time to stimulate, right? That water that we're injecting will dissipate over 3 to 5 days, but then it's going to work its magic and you'll start to see that Sculptra glow. We call it in about a month's time, and there's nothing like it. You want to talk about glass, glowy, dewy skin? That's like my favorite part of Sculptra.
Exactly. And a lot of my patients are like, okay, so how many like sessions do you need? So I'm finding, because I've done this for a long time and you've been doing it for 5 years, I mean, at least most patients need at least 3 sessions, 1 month apart.
Yeah.
And the ones that work out probably need more of it. So it does, for anyone that works out, I mean, your Botox is going to go faster, your Sculptra is going to go faster, so you just have to upkeep it a little bit more. But by like 6 months, you do see the results. And then it stays for a long time. So then your maintenance is actually very easy.
Absolutely.
So this is why we like it more, because you get this long-term impact and then a really easy maintenance.
Yeah.
So yeah.
Absolutely. I couldn't agree more. So the main areas that we do use for Sculptra, or we use Sculptra for, excuse me, is the face. As I mentioned before, the cheek area, definitely our nasolabial folds, right? So from that loss of the structure back here, things start to come forward. So we're treating the smile lines, the marionette lines. We can really help with the jawline contour there as well. Main areas we don't inject Sculptra are the under eye or chin. That we use other products like dermal filler, which will be a talk for another time. But we can also use Sculptra in the body as well. So not only our face ages, but the body also. So like your elbows, your knees, we can help with the skin quality in those areas. And then one of my favorites too is actually the Sculptra BBL. So we can help to fill out like those hip dips with Sculptra and stimulate collagen in the same way in those areas.
Right. Yeah. And when you come in, you do these procedures. I mean, honestly, there's no downtime. You can go back to doing whatever you want. We have a great protocol. We mix it with lidocaine and epinephrine, so none of our patients really get any bruising. And yes, there's a massaging rule after 5-5-5, which means 5 minutes, 5 days. But you can actually, my rule is actually twice a day for 2 weeks, which I think a lot of my patients just find it easier. So either of those two work. It's just that you do have to massage and move this product around so you don't get nodules. So yeah.
Yeah, I think we both use the same term in the room, like it is fertilizer. So you want to move that fertilizer around. The more you can move it around, the better the results will be. Yeah.
Yeah, that's good. That's true. All right, so I guess my turn.
Yes.
So if anyone knows me, I'm very passionate about regenerative medicine and peptides. So, for a long time, I just had Sculptra when I first started this business and got into the aesthetic space. And then there's good old regenerative medicine now. So we now can take it a step further because what we can actually do, or what we realize, remember, aging is happening on a molecular level, not just on the outside. So what we have found is there is a naturally occurring peptide that you have in your body called GHK copper, and it declines as we're aging. So, and definitely by 44, you probably don't have this GHK as much as you did in your 20s. So, why is GHK important? It is is the one that synthesizes collagen, specifically type 1, type 3, and elastin as well. It's an antioxidant, so it's going to prevent free radical damage, prevent UV radiation. It is also a wound healing property. So any of my patients that are post surgery or have any sort of some sort of trauma, they're going to also get the wound healing aspect of it, and it's anti-inflammatory as well. So not only do I use it for making the skin better, you get other things. Your hair gets better. You have a more of a luminous finish to your skin. And then you also, if you have autoimmune disease, lupus, any of those diseases, you're going to get that anti-inflammatory effect. So all my autoimmune patients get this too. So there's so many multiple reasons to get it. And forget it. Every patient of mine over 40 that is probably entering perimenopause of some kind, they're going to get GHK because it's a very inflamed time. And guess what? GHK helps with that too. So many reasons. If I can signal your body to do something better, this is why regenerative medicine is going to be blowing up for many, many years to come. Now, if you do GHK, there is a bit of a treatment protocol that we do advise, right? Yes, there's no big, large human studies. A lot of the studies are on animals, but we have enough data now to predict what is a good protocol for this. And that is, if you do it, you got to do it for at least 3 months. Why? Because the skin has many, many cycles. So in order for you to see the results, it's got to be 6 to 12 weeks. Same thing with actually any skincare, right?
Absolutely.
Any skincare that you start, you have to do it 6 to 12 weeks because of the cycle, the constant shedding of the skin, the cell turnover. So we need to give it some time. So same thing with GHK. Once you start, do it for at least 3 months. Okay. So now I feel like I have this extra superpower because now not only am I doing Sculptra, and I'm putting it in a specific area, I am further signaling the body to do an even better job at recruiting collagen to any given area. So the combination of Sculptra and GHK it's a powerhouse to me.
Absolutely.
Yeah.
Especially like once you get to a certain point in the aging process, it's that much harder for us to synthesize collagen. So we need multifactorial approach. If you want to exacerbate your results from Sculptra, supporting with the GHK. Plus, to your point as well, I love GHK for hair growth, especially because it's reducing that inflammatory property. And why do we typically lose hair? Yes, age-related factors, but also that inflammation around the hair follicle is essentially suffocating it, right? And that's what causes it to fall out. So when we do GHK, the results you get are absolutely phenomenal, especially for the hair as well.
Exactly. Thank you for sharing that because if you're going to come to Hebe, you're going to hear about GHK because everyone can do GHK because we are we are losing collagen at an accelerated rate, and everyone also wants to protect their hair. So what woman doesn't care about their skin and their hair? So
Exactly.
So yeah.
Yeah. Okay, let me take this one.
Yes.
Okay, awesome. So another one of my favorites in the biostimulator category is something called Radiesse. Radiesse is an FDA-approved injectable that is composed of something called calcium hydroxylapatite. It's a mouthful. And basically, what is that? It is a mineral that is very, it's naturally found in our teeth and our bones. And so it's essentially mimicking bone in the body when we inject it in its regular form. And it's something that is used to help with, facial wrinkles in the same respect that we would use Sculptra. Its original form is used to help with volume restoration in the same way dermal filler would be, but then it's going to help synthesize and biostimulate collagen as Sculptra will as well. Now, we can use it off-label, which is one of my favorite things to do, and it's called hyperdilute radius. And with that, we're able to also address areas like the neck, the décolleté, areas where we get that crepey skin to really help synthesize collagen and address skin laxity as well. And similarly to Sculptra, I don't know if we touched on this before. I think you did briefly, Dr. Z, but Sculptra typically lasts about 2 years if you do the proper loading dose and you keep up on your maintenance given other, extraneous factors. But Radiesse typically is about 12 to 18 months as well. And again, we use that in areas like the nasolabial folds, the preauricular area. You can use it, again, for volume restoration, for loss of fat pads and bone restoration as well. Yeah, and it most importantly stimulates types 1 and type 3 collagen, which Dr. Z touched on before, that GHK also does as well. So that's why the two together are a powerhouse.
So the one thing that I do love Radiesse for, and I think you'll agree, is that it actually recruits elastin too.
Yes.
While Sculptra just does type 1, and then GHK just type 1 and 3.
Mm-hmm.
So I feel that you should do all 3 of them because you still need the elastin as well, because the elastin really keeps that skin tight, and then the collagen keeps it thick. So I think you do this a lot with your patients. You are doing Sculptra, you're doing GHK, and you squeeze in that Radiesse, especially in in the lateral, in the more peripheral areas of the face. Jawline, and definitely the hands. This is why I think a lot of our patients will still see superior results because of that elastin.
Absolutely. And also too, Radiesse does something called angiogenesis, meaning it creates new blood vessels. So with new blood vessels, there's new growth, new collagen, new cells, all the good stuff that we want.
Good point.
Yeah. Ooh, my favorite. Okay. Some of our befores and afters. So for this lovely patient of ours, she did 3 sessions of Sculptra, and she did 2 vials per session, about 6 weeks apart. Typically, the rule of thumb is however many decades old you are is how many vials you'll need for your loading dose. And then maintenance is really dependent upon, again, your lifestyle factors. Do you work out a lot? Are you metabolizing it quickly? While other factors are contributing to that, but usually about 1 to 2 vials per session. Yeah. And this is our lovely other patient. She also did Sculptra. 2 treatments was all she needed of 4 vials, and she got a beautiful result as well.
Yeah, so you can see here, not only is the glow, you can see the thickness of the skin is just phenomenal.
Yeah.
And it's yours to keep for many, many years to come.
Yeah. And this is our other lovely patient. So she also did 2 treatments of 4 vials. And you can really see if you look at the medial portion of her face, we start to get this break in our fat pad right here. And you can see that was beautifully supported by the Sculptra, and we didn't even touch her under eye area.
Yeah, she looks so much wider.
Yeah.
Yeah.
Okay. All right.
All right. While we are waiting for some of the questions to come through so we can answer them, and before we give you all the great news that you guys are seeing, Dr. Z and Leanna, I actually have a question.
Okay.
A lot of we've seen on social media a lot of discussion around, we know a lot of people are using GLP medication to lose weight, and so there is a lot of discussion also how these people also losing a lot of collagen, and they do get that sunken face, as we call it, the
pont.
the pont, right? Do you feel that anyone that is starting a weight loss journey, because losing weight is really important, especially if you're overweight for your overall wellness, but you don't want to like really age faster because of it. Do you think that those treatments are appropriate for people that are starting a weight loss journey with a GLP medication?
I mean, slam dunk, absolutely. Because unfortunately, you can't have, it's very hard to have both, where when you are losing weight and you are in a caloric deficit of sorts, you are going to lose weight in your face. I mean, this is just the nature of the beast here. So in order for you to still maintain the thickness and the prevent the laxity of your skin to loosen, you're going to have to do Sculptra. And I think we are entering an era where we are noticing that this is a fact.
Yeah.
Every dermatologist and plastic surgeon and out there is noticing this. So we are now keeping an eye out for this, and we're actually telling our patients earlier than later to actually combine the use of these modalities to prevent the face from looking older, or yes, you will look older.
Yeah, no, I agree, definitely. If you can get ahead of it instead of having to backpedal, you're going to see great results. But it's really when you've lost that weight and it's like, okay, it becomes a journey as opposed to like all together in one cohesive treatment plan.
So what you're saying is we can look skinny and beautiful.
Yes.
Okay, awesome. We have a couple of questions. I can read it and you guys can answer as you go. Can I combine Sculptra with filler and Botox treatments?
Yes, you absolutely can.
Yeah.
I actually like to explain to a lot of my patients that you really do need both Sculptra and dermal filler. While Sculptra is excellent at what it does, like we mentioned, building that foundation, I do still find we need dermal filler to really reposition and support the fat pads in the face. And so the two together work beautifully, but they both have a different purpose.
Yeah. So I love analogies. Right? So Sculptra is the house.
Yes.
The fillers are the windows.
Yeah.
And the Botox is power washing it.
Ooh, I like that.
You like
one.
that?
That's
I just came up with it like right now. No AI. No AI. See, no AI.
Great.
No, yeah, I can vouch for that.
All right, next question we have is, which biostimulator do you recommend for the décolletage area?
Okay, so I'll take this one. I will pick Radiesse, but I would dilute it. Do you?
Yes,
Would you?
I agree.
Perfect.
Yeah.
I would dilute it because I would fear Sculptra in the neck and any of the chest because I am afraid of lumps.
Yes.
That's just me. So
I agree with that completely.
So you got two of the powerhouses here saying that.
Yes, I agree. I love it.
The next question is, can everyone take GHK? Are there any restrictions?
So anyone can take GHK. Mostly since with the data, over 35 is when we really start to see this shift because of hormonal changes and molecular changes. Those are the patients I'm finding are the ones that are going to need to start needing the GHK support earlier than later. But if you have any history of cancer or Wilson's disease, then you cannot take GHK. So it's just very important that when you come here, you're going to be obviously, we're going to go through labs, we're going to do a thorough history, and we're going to make sure that you are, you're safe to take this medication.
The next question is, if you stop the GHK, will you lose your hair that grew?
You can answer that.
So you're not going to lose your hair that grew, but remember that the hair has cycles, right? So our hair is in a certain cycle where it's already going to fall out. And so if you stop it, you might notice that hair that was already going to fall out is going to fall out. It's not a correlation to the GHK. It's just a matter of being in that one of the 3 hair cycles. Would you agree with that?
Yeah, exactly. Yeah. Same thing with minoxidil, right? Minoxidil, you take it, shedding, hair growth, and sometimes you lose steam and you stop using it.
Yeah.
Probably going to keep it, but then it's probably going to start losing again. So you're better off trying to stay on a consistent protocol.
Right.
Yeah.
And the nice part too, like we were mentioning before, you typically do 3 months on, 3 months off. So it's really a bi-yearly treatment that is building up in your system and is, going to withstand for that other 3 months you're not on it. Bless you.
Exactly.
Okay, the next question is, can you do both Sculptra and Radiesse in a single session?
It's so I'll answer this. I would say no, because with Sculptra, you're mixing this product with water and then you're injecting it. So now you're going to be falsely volumized at that time. So now, if I want to, Radiesse is not, it works very differently. It's a different product. So now I can't really, now you look great because you have all this volume. So I can't judge where do I need to properly place Radiesse. So my answer there would be two separate sessions, unless you're doing face sculpture and then you're doing hand Radiesse, then fine.
Yes, I agree with that completely.
Perfect.
So-
It's how many great questions. I mean, next one is if I'm planning a facelift down the road, am I still candidate for biostimulators?
Yes.
Yes. Huge debate I see on
Yes.
social media, but I think more and more they were finding you can. Because remember, facelifts just pull,
Mhm.
but they do not make your skin thick. They do not. Lasers make your face thick. Sculptra, GHK, Radiesse, fillers make your face thicker. So you still have to do these things.
Yeah.
So even if you do it before, it's fine. And definitely you have to do it after, because the skin only gets tighter from facelifts, not thicker.
Exactly. I agree.
Okay.
That's perfect.
The next question is if you're focusing on your jowls, which option is the best?
Ooh, this is a good one. Yeah. So where do jowls, the pre-jowl, come from? Loss of volume, again, this lateral portion, and loss of this medial fat pad. So I get a lot of times someone will sit in my chair and they're like, okay, this is bothering me. But really what's happening is we need to restore volume here and here to soften this before we restore that pre-jowl area. So it's a multifactorial approach, really facial balancing, again, with Sculptra, fillers, Radiesse, all that good stuff.
Yeah, agree.
Next question is how does GHK-Cu compare to PRP treatments for the hair?
So good question. PRP has been around longer. So PRP is good. It's okay. The problem with PRP is that you're taking your blood, you're spinning it down, and we don't know if did we really get a good batch from this. If you're taking certain medications, it can hinder the kind of, properties that are going to be in there to grow hair. So I'm actually a bigger fan of exosomes, which we don't offer it in America. A lot of, people actually abroad are shying away from PRP because we know it's inferior to things like exosomes, right? Anything that we can control and then manufacture that will specifically do something will supersede a PRP when you're kind of like, you might get a good batch or you might not.
Yeah.
So hard to say because we don't have big trials. We probably, if you look up PRP versus GHK, you're going to find more data with PRP. So then you will probably say, yeah, maybe that's superior. But GHK now is, in the next couple of years, we're going to have a lot more data on GHK because there's more people using it. So they work differently because GHK, I'm signaling your body to make something more, while with PRP, I mean, you're just introducing more like a, anti-inflammatory pathways. So they're different. So I would say do both.
Yeah.
Just to be safe.
And we'll take one more question.
Yeah.
The last question for tonight we're going to take is how many treatments would the hands need? So if somebody wants to rejuvenate their hands, how many treatments?
I would say 2 is pretty standard. And again, my product of choice is Radiesse for the hands too as well.
Same
Yes.
here.
So how Radiesse works is, you place it, you do get that immediate result from the filler component of it, but it's also going to stimulate again a few months down the line. And so I like to reassess at like the 2-month mark, and then we'll typically do another session, and that's pretty standard and works well
Yeah.
for a lot of people.
I mean, I see my patients see the results right away.
Yeah.
And then I tell them it gets better and better and better as the months and years go on.
Yeah.
So yes, a lot of them still do a second session because they're just so amazed by the result.
Yeah.
And I don't think I've done anyone after 2 sessions.
No.
And I've been doing this for almost a decade.
Yeah.
So, I mean, it's a great investment.
Absolutely.
Yeah.
Yeah.
Okay. Well, first of all, thank you
Thank you.
so much for this informative webinar. And also thank you everyone that joined. We know it's the evening and this is taking time away from your family. So we really appreciate you being here. One of the things that Hebe prides ourselves with a lot is that we always focus on education because we do believe that our clients need to know and need to be educated so they can ask the right questions and make sure that working with the right providers, they can find the best treatments for them. So thank you again. We really appreciate it. And as a token of appreciation, we wanted to offer you 20% off of the treatments that we discussed today, which will be the Sculptra, Radiesse, and GHK-Cu for 3-month protocol. All you have to do to secure that discount is text by the end of tonight biostimulators to one of our numbers, depending on which location do you guys prefer to go to. And we will give you a call tomorrow. One of our team members will give you a call so we can book your complimentary consultation. Thank you again. I hope everyone has an amazing evening, and we really appreciate you.